Coming up, we'll be on location at Dabb's Rehab Center in Columbia, Maryland, discussing the latest advances in medicine, including integrative, chiropractic, physical therapy, and functional medicine, along with weight loss, and how they can help you improve your overall health and well-being and lose weight with one of this region's top doctors, Dr. Vaughan. Dr. Dabbs received his medical degree from Logan College in chiropractic and orthopedic medicine. Dr. Dabbs is widely regarded as one of this region's top doctors. Welcome, Dr. Dabbs. It's a pleasure having you on our program.
You're welcome, Rocco. I appreciate being here.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients that we're going to hear from a bit later. But I wanted to begin, if I may, Doctor, because you and your practice, Dabb's Rehab Center here in Columbia, Maryland, have certainly established a reputation for excellence. You're one of the leading doctors in this region. You're helping a lot of folks each and every day with a wide range of problems. And I just wanted to have you tell us about how you built your practice to where it is today.
Well, it started about 25 years ago when we did a lot of chiropractic and physical therapy, and we eventually grew into rehab and training as well as functional medicine. And it all started really when I discovered that people with back pain, we could treat most of them, but some of them still escaped us. So I stumbled upon a secret when I went to Haiti and helped out there during the earthquake that 80 and 90-year-olds, I could bend their hips and knees fully. They didn't really have arthritis like they do here. I can't even do that to 30-year-olds here sometimes. And so with that secret, I wrote a book. This is how your back hurts, or why your back hurts. And with this information, we did all the principles and practices and changed everything in our clinic. And now we help tremendous amounts of people with back pain based on the secrets that I learned.
How ironic that it was a voluntary mission to help the people over there after the earthquake many years ago, and that led you to your discoveries that you've been utilizing and integrating in your practice over here all these years later.
Yes, I researched it, went all around the world really to discover that in third world countries, they really don't have the problems that we have. Yes. And when it comes to back pain, neck pain, shoulder pain, and other joint pain.
And those are problems that are very common here, as we know.
Very common here.
Now, as far as the integrative approach that you utilize here at Dabb's Rehab Center, can you please tell us a little bit more about that?
Yes, we integrated chiropractic, physical therapy, and medical all in one place, also including a trainer. And with all that, we put together a program that helps back pain, neck pain, shoulder pain, and we sometimes find that it's not always musculoskeletal physical, but it can be dietary, it can be some chemical in your body is causing it, and something else may be causing it. And we put it all together and come up with a plan to get people fixed.
I love the customized approach you utilize here.
Very customized.
It's not cookie cutter off the shelf, as some practices unfortunately utilize. It's much more of a customized approach depending on each particular patient, his or her situation and their needs, and then you tailor a treatment plan to help with that patient.
Very much so, yes, very customized to each individual.
Now, with all your experience and travels, what is the secret that you discovered about back pain? What
I found was that our what's called human positioning, other people call it posture, but really it's our positioning we put our bodies in this country. You know, basically our slumping posture, we have everything forward, didn't start really till the 1920s, and that's when posture really went downhill in this country. And that's when neck and back pain and shoulder issues and knees also rocketed up. And probably our biggest issue is we walk incorrectly, we sleep incorrectly, we sit incorrectly, and basically every posture we're in, we don't do it correctly, and our spines just break down, sort of the knees and hips.
And it's very interesting that you said it really, as a country as a whole, all of us, it started in the 1920s or so?
Yes, when it was fashionable to slump. Chairs, of course, were very made for slumping, and it just weren't good for you.
And it just kind of went downhill from there, unfortunately.
Now, sitting at a computer all day is probably the #1 cause of neck and back pain nowadays.
And what would you say are two of the most common misunderstandings related to lower back pain?
Is that back pain, can be fixed just with one surgery or one pill is the biggest misunderstanding. People think they can just take a pill and their back pain goes away. They think it's fixed when really it's just hidden. It's still going on. The mechanical effects of the problem are still there. And surgery may fix one little problem in the back, but back pain is usually caused by multi-problems. One of them may be just a disc bulge, and they take the disc bulge out, but they haven't fixed the rest of the mechanics.
And does diet have any impact on lower back pain or not?
Diet has a huge impact on lower back pain and obesity too. So I've seen patients who have pain in all over in all their joints, and I know that's something systemic and it's something wrong with them, and it could be diet related, it could be maybe they have parasites, maybe they just beaten themselves up in a massive car accident, but one of those things has to be, and we discover and find it and fix it with whatever those causes are.
Now, who should someone see for a back problem? Because a lot of folks out there, sometimes they think physical therapist, other times chiropractor, orthopedic surgeon, whatever the case may be. Who should they go to first when they have a lower back problem?
Usually the chiropractor is best for lower back pain and neck pain. Joint pain such as shoulders and knees, the chiropractor or physical therapist. A lot of our patients are referred by orthopedists and neurologists because they may see them first and they spend a lot of time there, get a lot of tests done, and realize that 99% of them are mechanical and send them to us anyway for fixing the mechanical aspect of them, because most aren't surgical. So the best person to see is the chiropractor or physical therapist.
Now, do surgery and drugs help with any of this, or do they work?
They can do. About 1% of back problems or neck problems may go to surgery or less, but most of the time not. And medication can usually just hide it and will make it worse. Occasionally does make it better, and we know when it makes it better and worse.
Now, the folks out there watching right now, some of them may not know if they'd be a good candidate to come to you in your practice and help them with whatever problem they may have with their back or their neck or other parts of their body. Can you please tell us who you would say is a good candidate for treatment?
A good candidate for treatment is anyone who has really had the pains come on recently, maybe from an accident or bending and lifting, or has gone the medical route and really hasn't gone as far as they'd like to get better, is a good candidate for us.
And you utilize a very integrative approach, as touched on a bit earlier, covering various treatments, functional medicine as well. You also help people regarding weight loss. Can you please tell us more about that?
Sure, we have integrated where we have chiropractic, physical therapy, and medical, because medical may be asking more questions about their general health and may discover things that I may not. So they are also involved, and they have medical may need a certain medical brace, or they may need trigger point injections or something like that to help out with their case or medication. But the chiropractic and physical therapy here really treats the cause of it, and they all mold together to get the patient better.
I love the fact that you have all those different modalities and specific treatments under one roof.
Yeah, it's all under one roof.
Yes.
So we have all aspects, and we all have a team approach. When a patient comes in here, maybe they just see me, but we all get together and we go talk about the case and review x-rays or MRIs and find out what's the best way to treat them, and then we come back to the patient with options on how to get it fixed.
I would say that based on what you've told me here today, that integrative approach is definitely offers many major advantages over, say, the traditional medicine approach, where you have a practice that's specific to one specialty, whether it be chiropractic care, a physical therapist somewhere else, so on and so forth, where you have all of those different specialists as well as specialties and treatments that you offer here at your practice.
Exactly. And although maybe just one of us treats them, but usually all three will treat, and it's up to really the patient and our team to find out what's the best way to fix that problem that they have.
Now, what type of results can we expect from the various treatments that you offer here? And I'm sure it depends on each particular treatment, each particular patient's situation, but in general, what type of results are your patients seeing?
95% of our patients get better, and it's because of the approach that we take that we hit everything that we could do to get their back better, whether it's traction, or we have decompression here, which is this huge machine that helps traction out their lower back in a specific computerized way, whether it's a medication or a chiropractic adjustment or physical therapy exercises. We have it all here, so 95% of patients eventually feel a whole lot better and pretty much dance out of here in the end.
That's a significant number, a very high success rate indeed.
It works. Yes, it does.
We're now going to hear from some of Dr. Dabbs and Dabbs Rehab Center's patients.
I've had chiropractic care off and on throughout my life for scoliosis, and also following a car accident I had when I was quite young that affected my cervical spine. However, recently I was diagnosed with not one but two full-thickness rotator cuff tears. The extensive treatment I'm getting at DABS with physical therapy, personal trainer, and Dr. Vaughan will spare me surgery, since the surgeon has already said he can't fully restore the shoulder. In addition to the intensive treatment I'm getting for the rotator cuff tear, I'm working with Dr. Vaughan on a functional medicine program that promises to help reduce my body's inflammation and hopefully help me heal. The staff are friendly, they're supportive. I feel like I'm among family when I'm here.
I've been coming since 2003. My most recent issues are I have bone arthritis in this shoulder and a herniated disc in my back. And with the team here, they put off surgery for me for now, from the shoulder 2010 and the back at least a couple of years. They gave me a full range of exercises to mobilize my shoulder, from using a ball on the wall. Also, Dr. Todd Johnsonbaugh talks about core stability. So I've done the wobble board before, and he basically has shown me, introduced me to how to keep my body comfortable, given my conditions. From the front desk, everybody here works as a team, and they're just fabulous. All the PTs, all the technicians. Really, you felt welcome here. And since 2003, I think they put off surgery for me. They've made me feel comfortable. I don't need the pain medications anymore, which is just, in my opinion, very, very, very gratifying. So I highly recommend anybody who has discomfort in the back, the shoulder, anywhere in the body, to come see them here at DABS Sports Medicine and Rehab.
Some years back I had a torn rotator cuff and didn't really get it looked at like I should, and sort of neglected it. And over the years it's given me problems. About maybe 5 years ago I stopped in and I saw the doctors here, Dr. Todd, and he worked on it, worked with me, and it's made a world of difference. Great interaction with the staff, from the front desk back to the CAs. Everyone works together here. Big family type of atmosphere. I fit right in because I'm a family-oriented type of guy. I've followed their recommendations, from even drinking the Kangen water that they give away, and I feel much better. Highly recommend coming here. Highly recommend. I mean, from an ache or pain, just to get routine maintenance. I come to get routine maintenance at least once a month. And I find that helps with aches and pains. A lot of prevention, really. They taught me prevention here.
We're now back with Dr. Daggs. Patients are very pleased with the results indeed, Doctor.
Thank you. We have a 97% approval of Google, so we are happy about that, and all we ever hear is patients come in smiling, saying they're feeling a whole lot better, and that's what I do it for.
Now, we're literally out of time, Dr. Dabbs, but I wanted to ask you before I let you go, you and your practice, Dabbs Rehab Center here in Columbia, Maryland, have certainly really achieved and performed at a level of excellence in not only your practice's approach and how it helps a lot of folks each and every day, but the patient care component, which I wanted to touch on, is very large here. You really, it's not just words about treating patients like family, like some practices unfortunately do. You and your staff here really seem to go that extra mile, if I may use that phrase, to really take care of each and every patient. I just wanted to ask you if you can please tell us a little bit more about that approach.
Sure. The approach is when patients come in, a lot of doctors may just say, oh, you got back pain, let's do a few tests here and there with, bend here, bend there. But we actually have them do a full range of orthopedic neurological testing, bring in blood tests if they need to, do a symptom survey of all their symptoms to see if other things are contributing to the back pain, like the adrenals, like thyroids, things like that. And then we try to correct the whole body while working with their medical doctor as well. You take that extra time to make sure everything is done the right way to help each patient. Exactly. And if it's just a simple sprain, easy to fix, then it's not very complicated for us. We treat it that way too, because not everybody needs a full treatment plan. They just need a little fix, and that's us too. And I also heard you and your staff follows up regularly with the patients to make sure that they're coming along, progressing nicely, and have them back in periodically for checkups, right? That's exactly right. I mean, I've been here so long, I'm treating grandchildren of the children I used to treat almost. So it's great to see them being referred in by their parents and their parents' parents. Absolutely. On that note, I'd like to thank you, Dr. Dabbs, for
for joining us, being a guest in our program. It was a pleasure having you on. We'd love to have you back on in the future.
Thank you very much, Rocco.